of issues here when it comes to teenage pregnancies here in the Upper East region. And then with me here is Madame Georgina. She is in charge of the children department here in the Upper East region. I would like to find out from her what her outfit is doing to help minimize these kind of issues that we have in this region. You're welcome to GBC News. Tell us what your outfit is currently doing to help minimize the issues of teenage pregnancy and issues affecting the girl child in the region.
Okay. Thank you very much. For the Department of Children, we are doing a lot. For instance, we engage the school children or the adolescents, the victims of this cancer. We go to schools, we educate them on the effects of teenage pregnancy. And this part of the country, when a girl becomes pregnant, there's a likelihood that parents will say that go and marry the one responsible. And so we educate them on how to abstain from sex. We tell them that abstinence is the best. Okay. And if some are sexually active, then we ask them to seek for help. We have adolescent health corners or health centers. They should go to these centers and talk to the midwives or the nurses there, and they'll be willing to support them. Apart from that, we also engage the parents. We have a program that UNFPA is supporting with Department of Gender, and Department of Children is actively involved in that program. And what we do with Department of Gender is to engage out-of-school boys and girls. We know very well that most of these victims, especially the adolescents, are girls from rural areas, girls who are dropped out of school, girls from poor families. So we engage them, we talk to them, and we try to link them up with skills training. We talk to people like those who wear clothes, if they can support them one way or the other. But we cannot help them financially, and so we talk to such people. Apart from that, we also engage the out-of-school boys, because an idle hand, the devil finds work for an idle hand. And we have most of these boys, especially those who operate the pragia or the kandus. A lot of them impregnate our girls, and so we also engage them to support the girls. We also we have also formed men and boys clubs in some communities that UNFPA operates in, and they are doing very well. So our trainings and other engagements with them, they serve as first aid caregivers in the communities where a girl is in need or needs their support.
Okay.
They go to them and then they support them.
Okay, thank you very much. Let me also go to Mr. Awa. He's Executive Director of RISE Ghana. Also tell us what your outfit is doing to help in reducing these kind of issues that we have at hand.
Thank you very much for the opportunity. It's always a pleasure to speak to GBC, and then good afternoon to your wonderful viewers. At our level, we do a lot of things in an attempt to curb this menace of teenage pregnancy and violence against our girls. One of the core things we do is to educate girls to understand their sexuality and their bodily rights. Generally, most of the girls do not understand their privacy, their bodily rights, and the risk of engaging in sexual activities. So we do a lot to be able to build their confidence, to be able, for those who are up to age, to demand safe sex, for those who are not, to be able to abstain and understand that there are certain parts of their body that is their private body. Nobody should be able to touch them in a suspicious manner. And we're coming from the background that if you look at the evidence from the Ghana Demographic Health Survey, majority of the cases that happen in terms of abuse are intimate partner violence. So most of the girls that get abused are abused by people who are close to them. We have seen cases where fathers have committed incest with their daughters, to sometimes even engaging to make them pregnant, not once, not twice. And then also we are educating community gatekeepers to understand that there are certain cases that are criminal. They shouldn't be sitting on those cases. Our traditional authorities, queen mothers, chiefs, and the rest, and religious leaders. We also have Momo agents. We have a support from one of our donors, Grameen, where we are training mobile money agents, 90 of them in northern region, northeast, and upper east, so that they will provide information and financial services to women and girls so that they can stay out of trouble and reduce their violence tendencies. The other thing is that we have community-based club, legal literacy clubs in schools that are encouraging, and they will call them he for she clubs, where men and boys support to ensure that they end practices like period shaming, period poverty. Period poverty is where girls are not able to afford sanitary pads they need when they are menstruating. And the evidence from UNICEF is saying that about 5.5 million of the adolescents in Ghana cannot have access to the sexual and reproductive health services they need. And so we are working with stakeholders to be able to ensure that they have access to these services, not only in a timely manner, but in a manner that is friendly, that is empowering, so that they can access it as a right.
Okay, thank you very much. So finally on Madam, what advice do you have for parents in helping to reduce these kind of issues?
Yes, for Department of Children, we tell parents this is the time you communicate always with your children. And so we have what we call parent-child communication. And you should not wait when the child is about 10 years or 12, 13, then you start talking to her about the changes in her body. No, we start right from beginning when the child is able to talk, when the child is able to understand whatever you tell the child. And so when the child knows that this is man body, like Awal said, and nobody should touch it, the child begins to understand that. And so when she goes out and somebody touches her body where that person is not supposed to touch, like the breast, vagina, and other sensitive areas, the child should come and report. Okay. And then we should also start educating them on the menstrual flow, menstruation. We wait when the first menstruation comes, then we start telling them this is what you are supposed to do. But mostly we should start before that time. Some of the children, girls, have their first menstruation whilst in classroom, and the shame alone is killing, and most of them had to drop out of school because of that.
Okay.
We have instances or cases whereby a girl didn't sleep at home, and when the parents admonished her, she committed suicide. Why should this happen? And that is because parents do not talk to their children. If the child knew that in our family you are not supposed to stay out of the house or sleep outside the home, she will not do that. So all that we are saying is that parents should communicate with their children right from the beginning. You shouldn't wait when they are at the adolescent stage.
Thank you very much. I would like to thank Executive Director of Rise Ghana, Mr. Ahmed Awal, and Madam Georgina Aberese for their time. For GBC News, Samuel Ayama, Abais, Bolga.